So I will do that. So you'll need to click the blue button, Samantha.
Oh yeah, sorry.
Otherwise, it'll say otherwise it will say got it on there. So okay, morning. So um, I'm just going to introduce myself first of all. So my name's Catherine. You'll see Breathwork Catherine down there. So my name's Catherine Charles. My pronouns are she, they, and I have multiple brainstem cavanomas. And I also have a side effect which I had at diagnosis, which is called HOD, which is hypertrophic livery degeneration. Okay, so you won't usually find very much on that. If you look on Alliance to a Cure, which was the angioma alliance, the USA, there's some reference to it there as well. So I was diagnosed about 5 years ago, I think. Totally, completely didn't know what was going on. Went for an eye test and had developed nystagma, osteopathy in my eyes. And within like 30 seconds to a minute of being there, the optician said, I'm going to need to refer you to the hospital. So I thought this was going to be an outpatient, right? No, do not pass go and go straight to hospital. So I then spent 11 days in hospital, and then various CT scans and MRI scans, and then MRI with contrast, and yeah, I had a brainstem cavanoma, and I had absolutely no idea what it was. Um, so that's just a really, really small amount about my story, something I live with every day, as do you, or you live around or care for someone in your life as well, possibly, who has a cavanoma. And yeah, wow, I felt really, really unsafe. Okay, so I think that was the biggest thing, is just the fact that I couldn't resource any safety for myself. So I was in full-time employment, um, had stepped back within the last year prior to diagnosis from being a manager because I just found it too much. I didn't realize that that was because my brain was bleeding, but that's what it was about. So since then, I have quit my job, um, and trained to be a meditation teacher first of all, and then found breath work. And I cannot tell you how revolutionary breathwork has been for me. Okay, so the one thing I wanted to say first of all is we need to be really careful when we're working with our breath. We need to be really cautious, and we need to approach it the same way in which we have the potential to approach ourselves, and that's with love and compassion. And I think having a cavanoma or being around somebody, you begin to realize, right, how finite life is. I talk about it a lot because it comes up a lot because I see a lot of people around me um, wasting time. And by wasting time, I mean they're not resourcing it consciously or moving with themselves consciously. Um, so I didn't know how to do this, just had no way of connecting with myself. My body felt really alien. So I think the first thing that we need to do when working with breath work is we need to make sure that we are feeling safe. Okay, we are in a safe environment, or we feel safe within our body. So when we are just recently been diagnosed with a cavernoma, or have multiple cavernomas, or have calves, we don't feel very safe. I felt as if my body had completely betrayed me. Yeah, I had developed something, and it was something rare, something that not a lot of people knew about. And, it just felt like my body wasn't my own. So I think the first thing is, if you're feeling like that, that can make you very, very anxious, because you're totally used to working from your head. And the head area, the brain and the brain stem, the spine, the nervous system, the spine, if you've got a spinal cavernoma, those are, that's a real place of safety within our bodies. And we start thinking, and we don't know what's going on. So let's first of all find a way to externally resource. So, what do I mean when I say resource? So, resource is to bring safety and comfort to your environment. So, if you have a hospital appointment, if you have an MRI scan, if you're in a waiting room, um, if you're at the bus station and you get really overwhelmed, this is like one of my go-to things. I have to really check in with my self-talk, and before I can utilize and reference my breath with awareness to tell me how I'm feeling, because my hippocampus and my thoughts at this point, when I get quite panicky, they lie. Yeah, so my breath can be relied on to tell me the truth. I orientate myself. One of the first things I do. So I will example the last time I went to see my consultant. Very old room. The first thing I'll do is check out 4 corners of the room. So just do that now where you are. Okay, you're in an environment that you've been for about 24 hours, so you're gonna feel an amount of safety. There might have been some tears, but just check out the 4 quadrants of the room. So look into one corner, and then look behind you or to the side of you to the other corner, and then to the other corner and the other corner. So you've got the quadrants of the room, so you know the environment that your body is in. Okay, so you've resourced into your environment, and then let's have a look around us. Yeah, we've got the yoga mats that I can see you're on. Just reach down with your fingertips and just feel them. Feel how tactile they feel. And then possibly, if you're feeling a bit braver, touch a part of your body, touch a part of your clothing. So your thighs or your hands. Yeah. Just resourced. Now you can, all this is resourcing so that you know where you are. You know where you are, and you know that you're complete. Okay, so you it doesn't matter what externally is spoken to you, is expressed to you, is happening to you. You might feel out of control and overwhelmed. There's an anchor. Okay, there's an anchor in your environment and an anchor within around your body, because we haven't gone inside the body as of yet. So that might be enough. Yeah, that might be enough to get you to relax, okay, to just soften slightly. And you might find that you want to carry something with you to help you. Yeah. Can be anything at all. Lots of people carry like my key ring. I've got a key ring, yeah, or some people have an elastic band around their wrist that they snap, yeah, sort of snaps them back into orientation as to where they are to provide a solid foundation to find safety. Now, once you've found safety, you can resource from there. Yeah, even if there's pictures, because I know what it's like being in a consultant's room. There's pictures of the inside of your brain on the screen. Yeah, and maybe it's not the best news, and you're having to hear that actually we need to do this surgery, but it's high risk. I love that word, high risk, because you know, it immediately just puts me on high alert, on high arousal. Yeah, my breath gets really shallow. So orientating yourself so you know where you are is one of the first things to do. You might want to get into the practice of doing it at home. Teddy bears are absolutely fantastic. You might think I'm a bit loopy, but stuffies, oh my gosh, they are so wonderful at resourcing. They have texture, yeah. So even if you're frightened and scared, there's like, oh, there's a texture, and you can place them on your body to protect those parts of you that are vulnerable. Your heart, for example, yeah, your heart's really nice and safe under that breastbone, under that cavity. But sometimes it's really nice to protect that area. You could use a picture, and you could use a blanket. I have the best relationship with my pillow. Yeah, my pillow. It doesn't matter how shit of a day I've had or how much I can't sleep. Oh, the smell of my pillow, yeah, is just wonderful and just helps me find that space where I can, even if I can't sleep, I can feel safe. So after we've done that, and it will take habit to do that, yeah, you won't just suddenly start resourcing and it'll be like, oh, I now feel really safe. You have to learn what safety looks like for you. Okay. And if you have separate trauma to the trauma of a cavernoma diagnosis, or the diagnostic journey has been complex and continues to be complex, that safety will provide a foundation, but it also, you might not understand what it looks like straight away. Yeah, and before we can approach our breath, it's important that we have that foundation. So if that's all that you start practicing when you say, I'm doing some breath work, then that's fine to start there. You have to accept where you are before you can go anywhere. So once we've resourced, we know that we always have that place. Yeah, we always have that place of resource, and we can gradually come further into the body. Yeah. So what I wanted to say at this juncture was, if you feel safe, don't go onto YouTube and Google breath work, yeah, because you'll get all sorts of breath work that some is absolutely wonderfully reliable because people have really been trained and really care, but you'll also get a lot of people that have done 2-day workshops, yeah, and they can, when you're working with breath, you're changing the physiology of your body, so it can have a lot of contraindications. So stay away from breath holds if you have a cavernoma. Just, this is something that you probably can practice, but you need to have a long relationship with your body and know exactly where you are before you do that. Okay, so we're not going to do any counting. We're just going to bring some awareness. So if we've resourced around us, we can then, when we feel safe enough, come inside the body and just listen to the breath. So don't change anything, don't close your eyes, just listen to where you are right now. So is your breath speeding up slightly? Yeah, because it's coming under the spotlight. It's getting a bit bashful. What does it sound like? Does it sound kind of full? You might have had some tears and some releasing yesterday, and you might still feel tired. How does that tiredness present on the sound of your breath? So just ask these questions of yourself. And then when you feel happy, and only if you feel happy to do so, and know that you can withdraw this consent that you're going to give yourself at any point, just close down your eyes. Just close down your eyes and listen for any changes in the breath. Is there a nervousness or a slight jarring to your breath? Or does it feel comforted or comforting? And then I want you to think about the apparatus that you're using. So the first thing we'll look at is our mouth and our nose. Now, when we first start connecting with our breath, we're just bringing an awareness to it. So there's no manipulation, there's no lengthening, there's no holding, there's no changing. So let's look at the mouth or the nose. Just take some notice as to which you are choosing to breathe through. And I would say, in my experience as a breathwork facilitator and as somebody with a cavernoma, it's probably best to close your mouth. Okay, most of us are habitual mouth breathers. So as you start to breathe through your nose, this might feel a bit strange. You might have to blow your nose. You could have a deviated septum. It might not be that easy for you. And if that's the point with which you meet your breath in awareness, then so be it. Yeah, remember, this is your awareness, your breath, your journey with your diagnosis and body. And very often when we start to breathe through our nose, we will discover these different idiosyncrasies of our body. So if you are breathing through your nose, what I would like you to do is just to think about the inhale and exhale. Just bring awareness to where the breath enters the body. You might feel that in the tip of your nose. Dreaming. Or you might feel it in your chest. You might want to put your hand on your chest or on your stomach, somewhere that feels comforting. If your resourcing has allowed you to feel safe enough. And we're just inhaling and exhaling. We're just listening to the natural rhythm of our body. Just expanse on the inhale and contraction on the exhale. Just expansion and contraction. We're just mirroring the plants and the planet around us, the seasons, the expansion of the light with the solstice that we've just been through, and the contraction, knowing that we'll come back to the light on the inhale. And after you've taken comfortably a couple more rounds, just drop any awareness, and reorient. If you've got your eyes closed, reorientate yourself as to the four corners of the room inside your head. If you've got your eyes open, just check out those four corners again. Just check out that whatever experience you felt, however you've come to this very, very short practice of breath work and of breath awareness, that you are still here. You're still safe, and you're still in the same place. And then just think about your points of connection with the mat underneath you. So that might be your heels, back of your thighs, your sitting bones as you sit down on the yoga mat. If you haven't already opened your eyes, you can open and reorientate yourself. Just maybe do some tapping. Really landing back in the body, because sometimes breath work can take you out of the body. Now that is like a really high level first approach to breath work. Yeah, you have to figure out where your baseline is. Okay, your baseline is really, you'll hear consultants talk about baseline. Yeah, you'll hear consultants with Cabernet talk about, well, I think this happened, let's take my bleed that I had in lockdown. I was experiencing some other symptoms, but by the time I got to speak to the consultant, I'd reached my baseline again. So what was normal for me? Okay. So when we first start to work with breath and we first start to work with awareness, we want a resource, we want safety, we want approach with care and compassion. We want to just bring awareness to where we are. And that's the same with the healing journey. Yeah. Even if that healing journey involves something that's inoperable, right? Because no one's going inside my head unless it's life-threatening, which, I have no idea if that will happen or not. Yeah? And that's a lot to live with. And the same for people that have epilepsy and seizures that are caused by seizures that are caused by their cavernoma. You don't know. Yeah, you have to be present, and to be present you have to feel safe. So I will answer any questions that anyone has. I can't really see anybody. My eyesight is terrible. So if there are any questions, Simona, maybe you could field them.
So, Kat, sorry, Simona's had to just go out to sort some stuff out.
Oh, right. Okay. Go for it, Ellie.
Hey. Does anybody have any questions at all? Somebody says something, otherwise I'll pick on you. Okay. Anyone got a question? It's Kat.
Hi, Kath. If you have visual problems, obviously you mentioned that you do yourself, and you was talking about familiarising yourself with the four corners of the room. Do you have any other tips or advice of what you could do if you can't visually, see that?
Yeah, that's a really good question. I have actually never approached it from somebody with visual episodes, or I don't know the word to describe it. But I am just sort of used to it, so I take it for granted. So thank you very much for bringing that to me. What I would say is, I have helped other people resource through sensory devices. Okay, so I work with quite a lot with people with cancer, and if they're newly diagnosed, again, it's quite similar. They find it very difficult to resource within their body, but they can, and especially if if there's anything to do with eyes or lungs, something sensory. So a sensory toy. I have actually got a fidget spinner here. Yeah. Okay. So this is my fidget spinner, and I know that it's mine. You can give it a name, and it's something that you can hold and you can place in your emotional and physical landscape as an anchor. Yeah, so that's what you need. You need to find something that uses another sense, yeah, and that anchors you in a point of safety. Yeah, don't put the anchor down until you feel safe. What I mean is, don't grab onto something and think, oh, I can use this, because it might not be the right thing. Yeah, you might need a small cuddly toy on a key ring, yeah, to orientate you. Does that help at all?
That really does work because I've suffered from eyesight and I've got a crystal and it recenters me. Oh, my crystal, it really does work. And it just recenters when you're going to have a panic attack and you know it does work. So if you find something for yourself, it does work. I'll just tell you that.
Yeah, thank you, Kath. Does anybody else have any questions or anything to say? What I would say, Kath, I know you probably did explain this, and I'm sorry if I'm making you repeat things, but what would you say the main benefits of people with cavernoma with breath work? What could it kind of change for them? What have you noticed?
Yeah, okay. So you can't get anywhere until you accept where you are. Yeah, I think we'll all sort of agree, and we all sort of we swim against the tide. So it can provide breath work connecting with breath awareness at this point in time, can just give that foundation, where you have, when you are going to go into panic, when you are given some news that maybe your body was telling you anyway, but you didn't want to accept. But you know, when you see a scan on the screen and a picture, so it can help with that anxiety. When you start to move from awareness, yeah, and you start to bring in some techniques, so box breath would be a technique. 4-7-8 is a breath for stress. Alternate nose breathing, all of these different techniques. This is why I say don't go on YouTube, because you'll be almost running before you can walk. Yeah, and actually, when you're rehabilitating from a brain injury, don't you sort of really need to crawl? Yeah, if you just jump into the techniques first of all, they will bring you many benefits: anxiety, increased sense of well-being, less panic. They'll also help your central nervous system and your organs, because your diaphragm, so I'm gonna show you. So your diaphragm is like a breathing tool that's here in the center of your body. Okay, so you've got your diaphragm here. So you've got more than one diaphragm, but that diaphragm is particularly important for visceral health, and visceral health would be the health of your organs. So if you're going to go for any sort of operation or any sort of physical therapy or any sort of stereotactical radiation, sort of makes sense that we viscerally, inside our organ health, we want to look after it. Yeah, all of these things help at a very top level what we call homeostasis, which is the body's feedback system and the body's way of finding balance. And I think when you're dealing with the central nervous system, so I include the brain as part of the central nervous system, it almost, when we talk about the battery analogy for cavernoma and for brain injury, you know, it's very difficult to get a full battery. That's usually because our homeostasis is affected. Yeah, we don't have enough energy, don't have enough battery to do everything all of the time. And when we practice breath work, we give our homeostasis, our nervous system, space and expanse. Yeah. So it doesn't matter if you think of it in a functional physiological way, or if you think of it in an energetic woo woo way, as I'm very often called, it gives you that space. And somehow that space gives you momentum to meet yourself exactly where you are. It doesn't heal anything, yeah. I still have multiple brainstem cavernomas, yeah. I still have hemiplasia. I still have dizziness. I still, in the evenings, can't find my words, yeah. I still have aphasia. I still find it easier to jump on the assault bike or the rower than I do to walk to the end of the street, yeah, because it involves less balance and less gait. Um, but I know that, and I meet myself where I am, and I understand much more about my body. That was a very long answer to a very simple question. Sorry.
Good answer, I think. My final question is, what would you recommend for starting off? I know you've said about techniques, but how long would someone need to start off kind of trying some breath work to get into it?
Awareness. If you're going to start with awareness. Okay. So just start by awareness, and I wouldn't say there's a time, just be consistent. Yeah, just show up in that space for yourself every day, even if it's just for 30 seconds or for a minute, and you'll find that that consistency, yeah, all the 1%, all the 0.5% will make a 1%, or the 1% will add up, and suddenly you'll find, actually, I know where I am now. Okay, I can work with the technique. When you are working with techniques, you need to be careful. You are affecting, most of the time, the pH of your blood. Okay, and you're working intrinsically with the nervous system. If you have epilepsy or have had a seizure, okay, or you have aphasia, any of these things, you need to move slowly and carefully.
Brilliant. Well, that's very helpful. Yeah. Thanks so much, Kath. You speak so eloquently and you've explained things really well. And I've learned a lot today. I think everyone's really enjoyed hearing you.
I'm really sorry that I couldn't be there. Yeah, it's just, as you know, yourselves, or you're around people, stuff takes a lot of energy, yeah. And coming over for the weekend, it would take me about 5.5, 6 hours. Signage, people, yeah, it would just, I'd probably be out for 3 or 4 days recovering. So, but I am sorry. It's very nice to be asked to join you this morning.
Well, I really feel we still all met you, and it's all worked, and we've heard you clearly, and everything's been fine. So sometimes in life, especially with chronic illness, it's about just finding a solution, another way forward, and this has worked great. So I'm glad
Absolutely.
that you're not out for 3 days unwell. And but thank you. It's been amazing. I've really learned a lot, and I think everyone can get in touch with you, can't they? We'll kind of connect.
Yeah.
Want to do more breath work stuff.
What was I going to say? Sim knows how to contact me. See, by the end of it, my words start to go. You see, the title on my name here is Breathwork Catherine. If you look on Instagram or breathworkcatherine.com, then I'm always happy to answer questions about stuff. I run a Tuesday during the day breath work and a group, and on a Wednesday evening, and I try and keep it really low cost. So there's a Patreon for £5 a month that you can sign up to and just come along, and it is literally for people who are affected by chronic illness. Yeah, so there you go. But any questions, I'm usually there to help. Yeah,
Thank you so much.
Thanks, Kath.
you're very welcome.
Thank you. You take care of yourself, and
Oh,